Good day, and welcome to the NCD Alliance webinar conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Dain, CEO of the NCD Alliance. Please go ahead.
Good afternoon, everybody, and welcome to this NCD Alliance webinar on the 22nd of August. We have a very, very packed agenda for you. If we all thought that we were going to have quiet summers, we should all all think again. A lot of different things going on in the NCD and global health world more broadly. Next slide, please. In terms of who we've got speaking today, we have a couple of guest speakers. We have Fiona, who is the WHO Program Manager on Surveillance and Population-Based Prevention of NCDs, who will be talking us through the process on the Global Action Plan on Physical Activity. We have Dr. Bente Mikkelsen, who is the head of the Global Coordination Mechanism at WHO, who will be walking us through updates on the WHO Global Conference on NCDs that is being held later this year in Uruguay in October. I will be giving a brief update on our Global NCD Alliance Forum, which is coming up. Priya Kanayson will be sharing updates on advocacy from New York in terms of the UN. And then Jessica Beagley from the NCD Alliance team will be providing you an update on WHO regional committee meetings, which are starting now and will run through until October. So we have a lot of different elements to get through with Q&A in between each of the agenda items. So just as a reminder, please do write your questions in the chat facility on your webinar platform. And also just as a reminder that all of the slides for the presentation will be available on our website at the end of the webinar, as well as a recording if you want to listen to any parts of it again. So with no further ado, let me pass over to Fiona Bull, who will be sharing with us an update on the new WHO Global Action Plan on Physical Activity, which is under development at the moment. Over to you, Fiona.
Thank you very much, Katie, and good day and good evening to everyone on the call today, and thank you for the invitation to join you on this NCDA webinar to outline and introduce, outline and invite engagement in the development of a new global action plan on physical activity. As introduced, I'm leader of the group here at WHO Geneva headquarters with an internal steering committee across the organisation and including regional offices. Next slide, please. What I'd like to do in the next sort of 9 minutes is give you an introduction to where is this opportunity and the development of a new global action plan come from, tell you some more about the actual contents of it, and conclude with inviting you and your organisations to both spread the word and get engaged with details about the consultation opportunities, closing dates, etc. Next slide, please. So you can see from this very busy slide a colourful collection of landmark milestones of what's been going on in physical activity over the recent 2 decades. And I use this just to sort of set the scene for those perhaps less familiar with physical activity and those involved, but to provide a sort of orientation. You can see the first top left is the 1996 landmark document that really positioned the consensus evidence of physical activity in NCD prevention and treatment. And it was followed thereafter by the first global strategy on diet, physical activity and health in 2004 by WHO. An important document, and it was within those early days of the early millennia where the WHO was leading on its agenda of NCDs, building its agenda on NCD prevention and treatment. The action plan laid out policy actions recommended to increase levels of physical activity and was followed in latter years with resources, those including about what works, framework, monitoring, evaluation, and of course the global guidelines in the top right in 2010, all providing a sort of policy background for action. But I've got to say, even by 2010, action was rather slow and physical activity had not changed dramatically. The bottom half of this slide shows well-known major events that have really started to try and transform our agenda and mobilise actions around the UN Declaration in 2011, the Action Plan from WHO in 2013, The global targets, which included physical activity, was a particularly important landmark. And of course, now we're entering the SDG era with the opportunities for unified and joint actions. And you see on the bottom right, it's within this framework that the Global Action Plan on Physical Activity fits. But it can be simplified and basically say this is the first significant document to focus solely on physical activity since 2004. Next slide, please. That's not to say that there's been many from the research and civil society community that have been aware of the need to act, to scale up and to implement more of the known effective interventions. And I'm showing you on this slide the sort of documents that have come out through consensus from the civil society, the Toronto Charter, really calling back in 2010 for more to be done by countries, 2011 answering the question of what is it that we should be doing, and there were 7 suggestions, and then most recently last year the Bangkok Declaration that seized the opportunity of the SDGs, and you can see by the diagram on the bottom right here, the identification that by working on some of the physical activity through physical activity and on some of the determinants of physical inactivity, we can contribute to 8 of the SDGs. I'd like to just focus on that remark a little more detailed in the next slide by saying, what do I mean by that? And on this slide you're seeing those 8 SDGs spelt out in a little bit more detail, showing that if we improve physical activity, of course we'll help SDG 3. But it's through providing and strategic policy actions in providing quality education, physical education being part of that, addressing the gender inequalities in physical activity, we can contribute to 4 and 5, and of course SDG 11 around healthy cities, and so the list continues. It's a useful list here, and one which the global strategy wishes to make sure is front and center in making these opportunities and co-benefits really evident. My last introductory slide, moving on to next slide please, is showing you that the evidence is strong, and here I've just selected some of the landmark documents which have really synthesized, firstly in 2004, the burden attributable to physical inactivity, and then these latter Lancet special issues which have focused on what we can do. So here we are, 2017. We know it's important, we know what to do, and we have a global action plan in terms of the NCD, next slide, which did outline for us in page 33-34 the policy actions recommended for countries, and now that's complemented with a global target of reducing inactivity by 10%. But I'd suggest that this opportunity to develop a new global strategy is providing us with an opportunity to really spell out and address why are we not making more progress, and what do we need to direct our attentions to. And just a reminder of the current situation, in next slide, you see a well-known graph now frequently used. It's the latest data. We are planning to update this in 2017-2018, but 23% of the global of the adult population globally is inactive. But I highlight some of the regions where it's substantially higher. And if the data were then unpacked within a region, it can reach 70 or 80%. That's 3 or 4 out of every 5 adults being inactive. You can see the trajectory when you look on the bottom right. The increasing economic development is leading to more inactivity. The change in transport, change in environment, change in recreation, leisure choices is leading to less active lives. Next slide, please. So it's within this context that the 140th Executive Board passed and requested that the Secretariat with Member States and civil society develop a new action plan, and it's seen as an opportunity, as I've already alluded to make greater efforts, focus attention, and build on the landscape that we have today. Next slide. This is a timeline slide showing you where we are, and we're in the busy middle phase with July, August, September being the consultation phase. I'm delighted this consultation on the web is drawing attention to the open online consultation, which is available to all organizations and individuals. But there's also regional consultations taking place. My last slide will show you those dates. And we're engaging with the missions and, of course, the other UN agencies. The deadline, October 1st, for aiming for the 2018 World Health Assembly. So what is it in my last few minutes? If we turn to the next slide, you can see the ambitions here, and these are a collective of our internal, but also with consultation and expert meeting. We hope that the Global Action Plan can raise political interest, but convert that to action and investment. Critically, we have to move from this being viewed as either a health and a sport issue to involving all the relevant sectors. And by that I mean the environment, the urban planning, transport, and broader society and the communities themselves. And that links back to that emphasis I placed on the SDGs. The opportunity is there, and I hope we can realize it through the action plan and its proposals. It needs to be feasible. Everyone is calling for a short, clear set of actions, and to stimulate the investment in those underpinning systems of research, data, capacity building, and use of technology and innovation in this space, which is sadly lacking. And lastly, to complement anything, I think we've seen successes in the other risk factors which have shown that we need to have the civil society and the social movement building around this area. Next slide. This is a pyramid. It shows you the architecture of the strategy. There have been no surprises, but I have made it for you to draw attention to the paragraphs which are available in the written document online to show you the first 43 paragraphs really set the scene. The part 2 is about the vision and goal. Part 3 is the core element of what are the objectives and what are the actions being proposed. And part 4 will link to the global resources and tools that we will follow up with in terms of supporting member state implementation. Therefore, I'll go very briefly through the context. The content. The next slide is showing you that part 1 is the global situation, and this is really for reference, not for me to go through in this call, but you can see here where the particular arguments are made, the patterns now and the inequalities, the policy synergies, the policy opportunities, and this is taking a new spin. The fact that we can be active in so many different ways mean there are different policy options. It may be through transport in some countries where they focus first, through sports sector, through education and the school setting, through workplace, through the home and community environment. Many options, different policies, different ways to be active. We need them all, but any country can start with where it is most appropriate to get early success. The costs of not doing something is an important part of the argument. The benefits of action complement. And of course the statement about it being too slow with evidence of why. Next slide. The goal, the vision, and guiding principles. And I invite you to review those and comment if they are ambitious enough and whether we've underpinned our approach with the correct guiding principles. The next slide shows the partners that should be involved, and there's no surprises here, but they're all listed, and we hope we've included everyone. If we've missed anyone, draw it to our attention. Next slide. This is an important slide because it starts to suggest a new way of thinking, or bringing back old language, if you like, that we really ought to focus on the behaviours that we're wanting. So you can see walk, cycle, play, sport, active recreation. This language plays through all of the actions. Next slide. 4 strategic objectives are offered. These are outlined in the next slide in more detail, and if you could just flick through those to bring them up. I think you're on PDF, so you can see all 4 objectives with their definition, showing you it's a sort of connected group. We need to build the environments, provide the programs, have the underpinning systems like research, data, monitoring, evaluation, accountability to create the active society. Of course, in the next slide you see that under each of those objectives we need specific actions and the roles that each can play, followed by indicators. Time doesn't allow me to go in much detail, but the last slide there is one strategic objective, and I focused on the environment there, showing you how it explodes out into 4 specific, tangible, relevant actions all countries should progress on. We invite feedback. WHO is very keen to get everyone's input on this, so my slide on feedback is inviting you to consider the different areas and structure of the Global Action Plan. The NCD Alliance is already calling for feedback, and the method to provide that in the last slide is through the consultation. Here's the web link to the email that you can send your consultation, and the available dates for consultations in your regions, and then FYI on when we're talking to the missions and the UN agencies. We invite your direct involvement, and we invite you to mobilize around this as an exciting opportunity. We're setting our ambitions on a 12-year plan, 2018 to 2030. And my last slide just shows where more information can be obtained, which also includes the background to what I've just presented, the webinar that we conducted last week, a longer version of this but the same slides, and of course again 22nd of September, and there's the email address for your contributions. Thank you very much for this opportunity. Back to you, Katie.
Thanks very much, Fiona, for that great presentation. And we at NCDA are really excited by this opportunity of the first kind of global action plan on physical activity, and particularly the timing of it all, considering that this plan will be adopted by governments just before the 2018 UN high-level meeting on NCDs. We haven't got any questions at the moment in the chat facility, so let me ask you one, Fiona, from myself. Obviously, WHO produces plans and strategies all the time, and some of them have more impact, and at the country level than others. I'm just wondering, with the Global Action Plan on Physical Activity, are there plans to have specific targets and indicators that then will be measured on an ongoing process?
Yes, there are, and so I briefly alluded to that in my slide, showing that for each of the objectives, the 4 objectives, there will be a set of indicators and a monitoring process. In the action plan itself, you'll find details where some of the measures that are already being collected in things like the country capacity survey and the ongoing progress monitoring of countries under the umbrella of the NCD action plan are, through to 2025 are there, but we surely will have some additional ones. Therefore, we'll be looking for what mechanisms can be used and what additional items could be put into those mechanisms. Of course, trying to avoid any too much additional burden. The challenge here, of course, is looking at some of those that fall outside of the health sector. So with the emphasis on the environment, we can see that we've got to improve the pedestrian and cycling environment. That includes road safety improvements. And some of these measures and targets are already there in other sectors. So we've got a joint goal to achieve some of those, and we can probably share some of the same indicators and monitoring systems. So I hope further information is available there, and we are planning a comprehensive monitoring and framework around this action plan. Thank you, Katie.
Great. And Fiona, can you just repeat the deadline for the consultation input? That's the 22nd of September, right?
Correct. That's online, must be received via the email provided in the last slide by the 22nd of September. Earlier the better. I invite you as soon as possible so we can be working with you and deliberating your suggestions.
Great. Thanks very much, Fiona. And apologies, I think a couple of your slides at the end there were missing from the webinar presentation, but we'll make sure that we have the full set published on our website later. So for those that missed the last couple of slides, we'll make sure that they're included. Thank you, Fiona.
Okay,
we'll move on to thank you. We'll move on to our next speaker. Can I just check that Bente is online?
I'm here.
Great. Thank you, Bente.
Yes.
I can hear you loud and clear.
Yes,
let me pass over to Bente Mikkelsen, who is the head of the GCM. Many of us know her very well at WHO, who will be sharing an update with us on the upcoming Uruguay conference. Over to you, Bente.
Thank you. I'm here together with Juliet Vitic, which is actually responsible on a day-to-day basis on all the communication for this very, very exciting conference. So hello to everybody. So as you mentioned, my name is Bente Mikkelsen. I'm head of the Global Coordination Mechanism for Non-Communicable Diseases. And we have been charged with leading responsibilities to organize for this very, very welcome, I would say, conference, which is hosted by the President of Uruguay. So it will happen in Montevideo between the 18th and 20th of October this year. And the co-organizers is beyond WHO, also the Russian Federation, Uruguay, and Finland. So it's a very good framing. Next slide, please. So the obstacle is the path. I think this is sort of to encourage all of us that are interested in NCD, because we feel that we have reached a critical point in the global movement to beat NCDs. We know that there is progress many places and in many cases, but still we haven't met our expectations and hope. And also there has been inconsistency, and also we have faced many bottlenecks and many levels of the society. And I think although NCD Alliance is doing an excellent work, we still have a lot more to sort of achieve when it comes to social mobilization for NCD. So we think that this is a new opportunity, and of course the momentum is created by our getting to 2018, where we will report back to the UN General Assembly about the progress in NCD, and maybe even more the SDGs and the goal 3.4, which actually picked up the main goal from the NCD to be able to achieve 30% reduction of premature mortality. So if you look at the next slide, the next slide please, yeah. You can see that the goal of the conference is really to reinvigorate global and national action to prevent then and control NCD. And this is especially true in enhancing policy coherence. So this is following up on a commitment made by heads of state, and it is really to realize the commitments of governments, heads of state, and all multiple stakeholders to achieve SDG target 3.4. So, of course, we need really a collective energy and momentum to be sure that we can reach across sectors. As all of you know, I'm sure that most of our interventions actually is dependent on action in or beyond health, even if health is sort of setting the agenda. So we say usually that 2/3 of our intervention is in other sectors than in health. Next slide, please. When it comes to the objectives of the conference, you can see that there are multiple, and all of them are very ambitious, but they are also very needed. So you can see that we want to, through this conference, to provide guidance to member states on how to reach the targets, and also hopefully to launch a set of new global initiatives. We also hopefully will have a huge sort of real engagement. We are trying to collect country cases of good examples of how to actually implement action on NCD. And we want to have an exchange on national experiences through the whole conference, and also highlight the health sector as the key advocate for enhancing policy coherence for the attainment of SDG. And also we see this as one of the key milestones ahead of the third high-level meeting on NCDs in 2018. And as you probably maybe know, we hopefully have reached out quite a bit with advocacy this time. We have a very, very nice video from the president of Uruguay, sort of really making a point of why we are doing this and what is his own agenda for doing this. So you will see that there are three sort of segments in the conference. It's a high-level segment for heads of state, it's a ministerial segment, and it's also a dialogue where we have invited multi-stakeholders to work together to achieve these targets. So we are especially happy that this conference is hosted at presidential level. That's unique, and of course we know that it is at this level where we have a proper chance of being able to mobilize policy coherence among different sectors. And it is important that we still continue to remind and also support the governments, because it's their influence, that their capacity is completely necessary to be able to achieve our targets. So we need new and also to showcase leadership that is ongoing. We have seen from the feedback from all the member states in WHO that they are committed. It's a huge political engagement. We have just now had a revisiting the Appendix 3 and all the interventions with also business cases for the different interventions. But we can see that there is a need to advocate for feasibility and also to get new voices on board to really underline and underscore that this is an investment and more than a cost, and it's really possible to make achievements. So we, of course, all of us know the excellent example from tobacco regulation and the convention, and this is also one of the reasons, of course, why we are going to Uruguay, who has really been super advocate for and also a winner in a very different case in the tobacco industry, so against the tobacco industry. So we want to learn from tobacco. We want to really revisit the many ways that we have worked towards curbing NCD and also look at different new models to do the same thing. So one of the things that has come back from many of the work that has happened during the last years is that we need to speak a language that also is understood by the Minister of Trade, Minister of Finance, Minister of Development, of course, but also education and all the ministers that needs to be involved to curb NCD. So the conference itself is also an important wake-up call, but also hopefully that gives hope to the feasibility of the actions that are planned or in place. Next slide, please. Why? I don't think we need to go through the slides, but of course it is actually, if you go to the next slide, still important to remind, especially when the governments are developing their development plans, the huge challenge that lies in the 50 million that die prematurely, and also the link to poverty and also NCD as a driver for poverty. Even if we know that NCD was definitely recognized in the SDG, we can see that this needs to be repeated, and hopefully we will be able, through this conference and all the preparations, to develop messages that are more understandable for a broader audience. We know that this is, next slide please, a challenge that you can see in all member states, but also unfortunately in the most poor member states, and they have now a triple burden or they have a triple burden. So of course, it is important to work on the advocacy. Next slide, please. So as I mentioned, a very big part of the momentum is, of course, produced by the adoption of the SDGs. And next slide, please. Is also the road towards 2018, which is actually next year, and then the road goes further to 2030. So this is then again to remind ourselves a very nice preparation for the meeting that will happen in September 2018. Next slide, please. Next slide, please. So the how is, of course, the most important. Next slide, please. And we think that one of the reasons why the Global Coordination Mechanism is chosen also as one of the main partners within WHO is because we have already 3 years of experience of working multi-stakeholder and multi-sectoral, and many of the tasks are very much linked to the challenge of policy coherence, like advocacy and raising awareness, dissemination of knowledge, and also innovation. Next slide, please. And for those of you who still doesn't know that much about the Global Coordination Mechanism, you can go to the website and see more about what we are doing. And of course, thankfully to the NCD Alliance, who has been one of our participants for a long while, this has been very helpful also in this preparation. Next slide, please. So coming back to the conference, so of course, key is the participation, and this time the non-state actors defined by the 4 categories of the framework of engagement with non-state actors in WHO has been invited by invitations to register. So at the moment we have 70 invitees that will be able to come to the conference, and we will use the FENSA, the Framework for Engagement of Non-State Actors, also when it comes to the engagement during the whole conference. So the whole conference is open, but it is some differences when we have hearing modalities and when we have dialogue modalities, in what way the non-state actors can engage themselves. We have an outcome document and it's under consultation. So if you go to the web pages of WHO, you will see that we very much would like your comments on the outcome document. And the consultation is open until 28th of August. And then the missions in Geneva, the member states will then reconvene and they will negotiate the outcome document, also called the roadmap for 2030. So that's consultations, and there will be a lot of advocacy and communication work ongoing. And I know that there will be also a meeting with a lot of non-state actors and their communication people next week, also to get some help from the participants of the GCM to support and strengthen the advocacy that is linked to the conference and to the work on NCDs. Next slide, please. Maybe that's the last slide. Well, so here you can see the conference. I don't want to go into details, but you will see it's an opening ceremony, and we are very, very pleased that Dr. Tedros, our new DG of WHO, will come. We will have all the co-organizing countries speaking. We will have an expert panel, and you will recognize Al Alwan and Ilona Kikbush. We will hopefully have the UN Youth Envoy speaking, and also NCD Alliance with Katie Dain in this segment. We will have ministerial forums with experience and also challenges for the future from different ministers from different countries. And we will have a high-level segment where the presidents will have their own sort of roundtable discussion. And of course, there will be a gavel moment where the outcome document will be recognized. And the second day will be a dialogue. So if you can, I can have the next slide, please. Next, yeah. So this is the high-level segment, and the next slide, please. There you will see that it's plenary sessions with 6 parallel workshops, 2 plenaries, and then all in all 12 workshops. And we will webcast the plenary sessions, and there will of course be rapporteurs also reporting from all sessions, and there will be a report with recommendation coming out of the meeting as usual. Then the next slide, please. And this is the last day of the conference, and we will have a final plenary where the RDs from WHO Regional Office and other also high-level speakers will sort of bring us some comments on the conference, the topic, and also the way forward, and the closing ceremony with Dr. Tedros and the President of Uruguay. So this is the program in short, and we will hopefully be able to publish an annotated agenda in some days, perhaps in the end of next week. Next slide, please. So we want your support, first of all, to use this momentum in your own work. Hopefully there will be produced policy briefs, background documentation that can help you, and we also hope for your support to bring examples, to bring country cases, and to help us to spread the messages which is necessary still on NCD. Next slide, please. Next slide, please. So this is just to thank you for listening to me, and you will also see that most of the information on this conference is on Policy Coherence 2017, or Policy Coherence on the webpage, and This is the email. If you have any questions or comments or suggestions, please use this email. Thank you.
Thanks very much, Bente, for that presentation. Really useful for everyone on the line, I'm sure, to hear an update of where we're going with the Uruguay conference. As we all see it as a great opportunity in the lead up to 2018. Do you have time for a couple of questions? Because we've had a few coming in. Yeah, great. Okay, thank you. So the first question was around kind of participation. You mentioned that there will be 70 non-state actors at the conference. What kind of numbers are you expecting in total?
300 is the expected numbers.
Okay, great. And in terms of non-state actors' participation, could you just maybe clarify the invitation process? It is invitation only, correct?
Yes, it's only by invitation. And it is a sort of a mixture of non-state actors already contributing through the global coordination mechanism on NCD by being participant of that mechanism. And it's also non-state actors suggested because they are speakers and contributors to workshops and plenary sessions.
Great, thanks. And for those that have registered their interest, do you know what sort of date people will be getting confirmations?
I cannot be completely clear on that yet, because when they have registered, the next step is that there is a due diligence process, and then they will get a letter of confirmation. Okay, thanks. So that should be coming up soon. I'm supported here, and I'm just gotten information that they will get it by the end of the month.
End of this month. Fantastic. Yes. Great. So end of August, people will be receiving confirmation of their attendance in Uruguay. Great. Thank you.
That's right.
I had another question around the kind of role of NGOs at the conference itself. What sort? I mean, obviously you mentioned in day 2 will be the multi-stakeholder dialogue. Will there be opportunities for speaking roles or for making statements or anything like that for NGOs?
So the modalities for the first day and also for the third day, and I think Hannah taught this online, so please supplement me on this, Hannah. But it will be hearing modalities the first and the third day, and then it will be a dialogue engagement for the second day, namely during plenary and workshops. So statements and so forth will then be the prerogative of the moderator of the session and the co-chair of the session, and that is what I can tell you so far. For the workshops, it will be, of course, a normal dialogue, roundtable. It's a little bit different from workshop to workshop, what kind of modality, but it will be definitely an exchange of experience and so forth.
Okay, great. So day 2, there'll be much more opportunity for dialogue and involvement of NGOs. Day 1, maybe a little bit more kind of high level with the kind of the general kind of plenaries that we're used to.
Yes.
Yeah. Okay, great. Thank you. We had a question about how are the various workshops being organized? Yeah, so the workshops are organized by sort of focal points from within WHO, most of them, not all of them. So they are usually experts from HQ or from a regional office, and they will all of them engage non-state actors as speakers. So they are now developing these workshops, and different people are then contributing to the content of the workshop, and it will be a normal sort of preparatory process with preparatory telephone calls and so on with the involved in the different workshops. Okay, thanks. And with the workshops, is there an expectation that there will be a report back, or how will that work? All the workshops will have rapporteurs, one rapporteur, one moderator, and the rapporteur's report will hopefully be summarized after the second day and will be reported back through the app
that is available for the participants. And also all of this will go as inputs to the report from the meeting.
Okay, great. Thanks. Sorry, lots of questions coming through. Another question we had was, can you share some of the examples of the initiatives to help countries that will be launched at the conference itself?
So that's definitely under making, but as I mentioned earlier, some obvious ones are the new sort of renewed Appendix 3 will definitely be launched. We have several initiatives on different areas, like in physical activity, some on childhood obesity. I cannot be very precise at the moment, and there is still opening for more. So if any of you have some ideas on what could be an innovative solution, it's still sort of definitely an interesting email to get from you to the Secretariat.
Okay, great. So that's a request for any suggestions of innovative solutions that could be launched in Uruguay. Fantastic. Next question, going back more to the kind of participation of the conference, Bente, we had a question around government attendance. Are we expecting it to be, I know that obviously the aim is to have some heads of government and heads of state there. Is there also a plan to get representatives from sectors beyond health? What are the kind of expectations around government attendance?
Mm-hmm. So what we have been working at kind of an ambition level is to have at least one head of state from each of WHO regions. So that is still what we are working to try to achieve. And then for ministers, definitely we have tried to get ministers from beyond the health sector. Will we succeed? That is still an open question, and I think if any of you have any influence of the government who actually nominates who is attending the conference, there is still an opening for that. So far we can see that it is, of course, more ministers from ministers of health than from other sectors.
Okay, great. So our network can certainly be helping in promoting the importance of this conference to their governments and encouraging high-level participation in Uruguay.
Absolutely. So the deadline for visa is maybe the deadline that will sort of determine when we have a deadline really, and that is I think it's 18th of September or something. Yeah. Mid-September. So there's still a couple of weeks to try to influence more governments to send representatives both at the presidential level and also, of course, minister level, especially from beyond Minister of Health.
Mm-hmm. Great, thanks. A couple of questions around the kind of outcome of the conference. So you obviously talked about the Montevideo roadmap, which is the official outcome document. Can you just clarify the process that it's been negotiated? So it's been negotiated in Geneva by the missions there and then will be formally adopted in Montevideo, right?
Yeah, so there will be no negotiation in Montevideo. That's very important. So it will be pre-negotiated here in Geneva, and that will happen now in the coming weeks. I think the first meeting is next week, sometime next week. So of course it's very important that all of you really engage yourself. This is very, very important. I mean, this is a golden opportunity. We think that language that is sort of coming into this document now, of course, will have a pretty good chance to also get into the next document, namely the one that will be negotiated before the UN General Assembly in September 2018, and the negotiation will be early spring next year. So I think that's maybe my strongest sort of call for action just now from all of you, is that please look at the first draft and see what is missing, strengthen what is needed, come up with your innovative solutions, and so forth. So the negotiation will happen among the missions in Geneva.
Okay, thank you. And for those on the call that have inputted into the NCD Alliance's own kind of call for comments, thanks everyone for providing us with some really good input. We're currently finalising our submission, and we'll be sending that around middle of this week to our network, and obviously submitting it to WHO, and encourage everybody else who is in the process or hasn't begun doing it to really focus on it, as Bente said. And the deadline for the online consultation is the end of this week, correct?
It's 28th, so it's also
28th. Yep.
Yeah, 28th. I have to check. Yeah, it's
great. So
Monday.
that's next Monday,
including Monday.
Yeah. Okay. So end of Monday deadline.
Yeah.
Great, thank you. And just one final question, Bente, then sorry, we'll let you go. You mentioned obviously that this roadmap will be feeding into the 2018 high-level meeting. What sort of status will the Montevideo roadmap have in the 2018 high-level meeting? Will it be an official document, or will it be just something that is informally feeding in?
So how could we put this? I mean, this is an intergovernmental negotiated document. So I think the fate for the document will depend on the member states themselves, if they want to pick it up in executive board meeting, World Health Assembly, and so on. So I think the only thing I can say is that this is an intergovernmental negotiated document. So of course that is the strongest kind of document beyond sort of what the member states do during their governing body meeting. So I think I would like to just underscore that we believe that this document will be very important and influential for the process towards 2018.
Great. Well, I think we've come to the end of the questions. Thanks very much, Bente, for joining us. It's been really helpful to hear all the updates on Uruguay and to be able to ask those questions. So thank you very much for joining us.
So thank you very, very much. And I forgot to mention we also have in sort of linked to the Montevideo meeting, we also will have a couple of global coordination mechanism meeting, a couple of breakfasts meeting, and so on. So, which is also a golden opportunity for the non-state actors and all the participants in the meeting to attend to. So we will be able to inform of all the different activities, hopefully before the end of the month.
Great. And Bente, sorry, just one final question, because one of my team has flagged that the 28th of August is actually different from what it had said on the website. So is that a change of deadline? So we're now saying Monday the 28th, final opportunity to comment on the roadmap.
That was my latest update from my team, but I will have to recheck. What's on the website now? Is it still 31st?
25th.
Oh, 25th. Uh-huh. So,
Bente, perhaps I can jump in there. So the clearest guidance is go with what is on the website, because all submissions will need to be published, and then they'll need to be collated and sent to the various missions who will be present in the member state briefing on the 29th. So please go with the 25th as the hard deadline for finalising your submissions. The collation of submissions and any additional information can still be received on the Monday, but by Monday evening it will be sent to member states.
Mm-hmm. So I think we will follow the advice of the youth voices here, Juliet.
Sorry for not introducing myself, but I just want to make that very clear.
That's great. So maybe you could repeat. So then the deadline is on the 25th of August.
25th of August, in particular for having your submissions published for others to view. And then Monday will be when the final submissions are collated and supplied to member states who will be meeting on the 29th.
Great. That's very clear.
Thank
you very much all. So 25th of August, final submissions in, and I think that's a great point that Juliet just made as well, that WHO now publishes all submissions, and so government can, and everybody can see what different people have commented on. So good opportunity from an advocacy perspective.
Great.
Thanks very much, Bente, and to Juliet for joining us.
And Hannah Todd as well. And thank you so much for the opportunity and the support for the meeting.
Great. Thanks, GCM team.
Thanks.
Thank you.
Okay, so now we move on to our next update. Let me hand over to Jessica Beagley from the NCDA team to provide you with an update on the WHO Regional Committee meetings.
Hello everybody, and thank you for staying with us so far. This will be a fairly short update, but the main thing to emphasize is that we would love to coordinate with everybody who is attending or has advocacy points that they would like to be promoted at the WHO Regional Committee meetings. So please do get in touch if there is more that you would like to know than I'm going to cover in the next few slides. So the NCD Alliance, last year was the first year that we'd had more involvement at the WHO Regional Committee meetings from some of our national and regional NCD Alliances, and this is something that we're going to be replicating again this year, recognising the power that they have at their own national and regional level to ensure that global WHO agreements are adapted effectively to unique regional contexts. And you can see the dates for the WHO Regional Committee meetings at the bottom of this slide. Moving on to the next slide that covers some of the agenda items. This is extremely top line, so again, please do get in contact if you'd like to know any more about any of them. But what I would like to do is to focus on the AFRO meeting because they have an NCD framework for integrating NCDs into primary healthcare systems, which is the first time that AFRO has had a WHO regional framework on NCDs. And if you find this paper on the WHO AFRO Regional Committee website, I'll also hyperlink it in these slides and you'll be able to access it once they go online. But yeah, obviously it's fantastic that AFRO does now have an NCD framework, but slightly disappointing that it's limited to primary healthcare and doesn't go into the detailed policy interventions that we could be seeing relating to the new WHO Appendix 3 with the cost-effective interventions that's just been adopted. But the positives of the framework is that it is heavily focused on prevention, which is maybe something that you wouldn't imagine from something that's entitled primary health care, so we're really pleased to see that comprehensive approach to care. And in terms of targets and milestones, what the framework is hoping to elicit by 2030 is that all member states would have adapted and are using the WHO PEN package, that's the package of essential medicines for non-communicable diseases. More than 80% of health professionals will be trained in managing NCDs at the primary healthcare level. All member states will have essential medicines and basic technologies for NCDs in their primary healthcare facilities, and all member states will have systems for collecting mortality data on a routine basis. And we're glad to see too that there are also milestones by 2020 and 2025 to ensure that AFRO is on track for delivering that 2030 target. Something that is interesting to see, although the framework is focused on primary care, it does list a number of challenges for the NCD response in the AFRO region, one of which is industry interference, fighting tobacco, alcohol, and food and beverage industries. So despite the framework itself being focused on primary healthcare, it does seem to have some sort of scope for expansion, which is really interesting to see. In terms of the priority interventions and actions that are listed in the framework, there's going to be adaptation, utilisation of WHO guidance documents for prevention and control of NCDs at primary healthcare level, and that again focuses on the WHO PEN package. And there's also going to be a review by a multi-stakeholder group to review and assess the success of the project, which is great to see. The capacity of human resources for health will be strengthened to deliver NCD prevention and control. This is going to be achieved through systematic training to improve the knowledge of skills of health workers in primary healthcare facilities, and there'll also be task shifting and sharing, including delegating some non-clinical tasks to community health workers. NCD prevention and control will be better incorporated into pre-service training curricula, and there'll also be promotion of use of information technology, so that's e-health and m-health. There will be improved access to essential NCD services in primary healthcare facilities, so that's increasing access to affordable, safe, effective and quality medicines and diagnostic technologies. And finally, NCD surveillance systems will be integrated into health management information systems. And we hear a lot about this from the cancer community, and it's generally not so widely spoken about for the other NCDs, but is very important, so glad to see it there. In terms of other things that are happening at the Afro meeting just to celebrate the fact that there will be a side event on psoriasis, which is hosted by the International Federation of Psoriasis Associations. We haven't previously been aware of side events happening at WHO regional committee meetings, so it's great to see NCDs being recognised on the sidelines as well as in the main agenda with a dedicated side event. I won't go into now the other agenda items being covered at Afro and at the other regional committee meetings, but again, if you've got any questions or if you'd like to be more involved, please do let us know. In terms of our advocacy priorities at the WHO regional committee meetings, we're very conscious that this is the final set of regional committee meetings that will be taking place before the high-level review in 2018. So these briefing points are also going to be contained in a briefing document that will be circulated within the next day or two. But this is what we're hoping people will be able to push for the national governments to do in the lead up to 2018. So obviously the obvious one is to accelerate implementation of the 4 national time-bound targets that were agreed in 2014 at the UN review then, to ensure high-level multi-sectoral representation at the 2018 meeting, going based on the fact that although NCDs have their effect on the health sector, their roots are across multiple sectors, whether that's urban planning or trade or education. And that links to the next point on mobilising sectors beyond health. We need everybody to play their part, and which also links to the next point on having an action-oriented outcome document that has bold commitments for all relevant sectors and not only the health sector. And we need to address barriers to policy implementation and build strategic alliances between countries. And we also need to ask WHO member states to be working with civil society, young people, and people who are living with NCDs. The response. And that's everything from me, unless there are any questions.
Thanks, Jess. I don't think we have one question. Are the WHO RCMs open for parties other than member states, i.e. non-state actors?
Sure. So non-state actors are invited to WHO regional committee meetings if they are in official relations with WHO. It's sometimes possible to attend on a delegation of a non-state actor who is in official relations if your own organisation is not in official relations, and there are some rare circumstances where the WHO regional offices will make an exception and invite a non-state actor who is not in official relations. Sometimes representatives from NGOs are invited to participate on member state delegations, although this, it's worth noting, would mean that you might not be able to be quite so active in your advocacy as you would be if you were attending as a non-state actor.
Thanks, Jess. We've also got a question from Oystein about, could you say a little bit more about the alcohol item on some of the RCMs that you mentioned?
Sure. I'm not actually able to go into a huge amount of detail on the alcohol items at the different regional committee meetings, but I can tell you where the alcohol items are up for discussion. So hopefully that's some use, and then maybe we can talk more with Lucy over email after the call. So in terms of NCD, so the CRO has got a review of progress on the regional action plan to implement the global strategy to reduce harmful use of alcohol. Euro has also got an alcohol agenda item, and that's it for dedicated alcohol agenda items, but it would be good to talk more after the webinar.
Jess, this is Elena. Maybe I can also add just a quick word here to try and respond to Oystein's question. People on the call may be aware of the calls for a higher prioritization of alcohol control on by WHO, calling, for example, for a review of the global strategy in previous World Health Assemblies, or even for a legally binding document. And so I think there's some potential for this to come up at the regional level, and if anyone on the call is working on alcohol control specifically and is attending the RCMs or wishes to somehow get involved in advocacy aimed at stronger prioritization of alcohol control on the executive board in January, and the agenda of the executive board in January, I encourage you to reach out to us, and we can fill you in on different advocacy plans that we have for the RCMs.
Thanks, Elena. We have no more questions coming in on the RCM, so thank you, Jess, for that presentation, and let's move on to the next agenda item. We wanted to provide a quick update on our second Global NCD Alliance Forum that's taking place later this year in Sharjah in the United Arab Emirates. Next slide, please. You'll remember that we held our first Global NCDA Forum in 2015, again in Sharjah, and it was the first time that we were able to bring together the global NCD civil society movement, particularly the network of national and regional NCD alliances that has been growing month by month over the years. Now there's over 50 national and regional NCD alliances around the world. So we're really pleased to be having our second Global NCD Alliance Forum on the 9th to the 11th of December 2017. For those of you who are diabetes advocates, this is taking place immediately after the IDF World Diabetes Congress, which is the 4th to the 8th of December in Abu Dhabi. So you just have to jump across to the other Emirates for our Global NCD Alliance Forum. Similarly to 2015, the forum is hosted by us, the NCD Alliance, together with our local host organisation, which is Friends of Cancer Patients, a UICC member. And it's being held under the patronage of the wife of the ruler of Sharjah, which we're very pleased to have again. And she has been a very active advocate on childhood cancer over the years, and is increasingly getting more and more involved in the broader NCD agenda, which is fantastic. The theme for our second Global NCDA Forum is stepping up the pace on NCDs, making 2018 count. And the real thinking behind this is that we are obviously wanting to frame our whole forum this year around the 2018 UN high-level meeting. It will just be 6 or 7 months ahead of the 2018 UN high-level meeting. And so we want to use it as an opportunity to bring together the civil society movement, to be promoting and launching our priorities for the 2018 high-level meeting, and most importantly, to use the time to be strategizing and planning for the next 8 or 9 months leading up to the 2018 high-level meeting. Next slide, please. In terms of the objectives for the forum, as always, we are fairly ambitious with our objectives. You'll remember that in 2015, the forum resulted in the Sharjah Declaration, which was a declaration, developed by civil society and for civil society. And so this time round, we want to further the Sharjah Declaration by facilitating advocacy campaign planning towards the 2018 high-level meeting. That's really the focus of this one. As always, the forum will be convening civil society networks, particularly the national and regional NCD alliances. It's a great opportunity to be sharing lessons learned from across the different regions, from different advocacy groups, and also to be connecting stakeholders across the sustainable development community as well, because obviously now NCDs are included in the SDGs. One of NCDA's mantras is really about kind of breaking down the silos and building synergies with other areas of sustainable development. And that will be a key theme coming through the 2017 forum. The third objective is really something that NCDA has taken on over the last year to promote the engagement of people living with NCDs and youth in the NCD movement. You'll probably be familiar with our new initiative, Our Views, Our Voices, and the consultation that we're holding at the moment to listen and hear about the priorities of people living with NCDs, and we'll be developing the advocacy agenda for people living with NCDs and launching it at the forum in Sharjah. Also the objective, as always, the forum is really our flagship capacity development initiative, so one of our objectives is all around strengthening the capacity of networks and alliances at the national and regional level in areas such as coalition building, sustainability, and specific advocacy issues. And then finally, as I've mentioned, to build consensus on the advocacy priorities that we will all be pushing for in the lead up to the 2018 high-level meeting. Next slide, please. In terms of participation, we are expecting and aiming for 300 delegates. It is an invitation-only event. As I mentioned before, we're primarily targeting our national and regional NCD alliances. So we're aiming for over 50 national and regional alliances to be in attendance, with 2 representatives from each alliance there. So it really is a fantastic opportunity to be networking and to be getting to know other advocates working in this space, and really trying to understand, what are the key ingredients of success of working in coalitions and alliances, which is something that many of us continue to grapple with. The overall audience, as well as obviously civil society, it will be a multi-sectoral event. So we'll be having our supporters, private sector supporters, UN agencies, governments, as well as academia and media. So it's a real mixture. And just like in 2015, we set ourselves a target of 10% of delegates will be youth or people living with NCDs, which we view as being a really important target. Invitation and registration process has started, and this will be continuing until the 1st of October. Next slide, please. In terms of the program and the planning, in terms of how the conference will look, before the actual official forum starts, we will be having a pre-meeting for our youth delegates, which is being organised by NCD Child, so that will be 7th to the 8th of December. The official program gets started on the 9th of December. The beginning of that day will be focused around pre-forum regional meetings. So obviously, because this forum is really about national and regional alliances, we're wanting to make sure we've got space for alliances to be breaking up into their regions and to have time to be planning for 2018 and obviously to be kind of sharing progress and priorities over the next year or so. Then following that, in the afternoon and the early evening of the 9th of December, then we have the opening ceremony and plenary and the gala reception. And then the 10th and the 11th of December is where the official program of the forum will be. And the way that this will be structured is similar to the 2015 forum. We'll have a combination of plenary sessions followed by workshops. And just like last time, our workshops will be organized and co-organized by multiple different organizations focusing on priority issues. And our program will be available online in September. It's just going through the final stages of development. We're going to have 3 different workshop streams, and the 3 streams are there on your slides. So the first stream will be focused on issues of advocacy for NCD prevention and control, so focusing on priority issues for advocacy. For example, there'll be one on financing for NCDs. The second theme is around breaking down silos and building synergies in the SDG era. This is all about what I just said earlier about NCDA's mantra of really maximizing and leveraging the SDGs for NCDs, and by making connections to perhaps the unusual suspects that we don't always work with. So those workshops will be really focusing on good practice and examples of where NCD advocates have been effective in working with, for example, the environment community, women's empowerment and gender groups, etc. The third workshop stream is around sharing tools and strategies for advocacy and mobilization. So this is the real rolling up your sleeves and very practical tools that we can be sharing throughout the forum. So those are the 3 workshop streams for the forum. Next slide, please. And that was it. We just wanted to provide a quick update of where we are with the forum and just to share with you the plans going forward. Are there any questions on the forum? I don't see any in the chat facility. Let's keep moving, and then we can always come back if there are any that pop up afterwards. So the next presentation is from Priya Kanayson from NCDA in New York, and Priya will be sharing kind of updates of recent activity at the UN from an NCD perspective. Over to you, Priya.
Thanks very much, Katie. You can go ahead to the next slide, please. So the first update is a brief summary of the recent UN High-Level Political Forum, or the HLPF. And just as a reminder, the HLPF is the main body of review of progress towards achieving the Sustainable Development Goals. And this year was actually the first time the HLPF reviewed a subset of goals under the overarching theme of eradicating poverty and promoting prosperity in a changing world. Again, the goals under review were Goal 1 on poverty, 2 on nutrition, 3 on health, 5 on gender equality, 9 on sustainable infrastructure, 14 on marine resources, and 17 on partnerships. So this 2-week session held from the 10th through the 19th of July here in New York included thematic reviews of each goal, high-level dialogues, and quite a lot of side events. And the review of SDG 3 included a presentation by the UN Statistics Division on available data for SDG 3 indicators and targets, and provided a snapshot of progress towards achieving the goals under SDG 3, the targets, under SDG 3. And really showed that while progress has been made to reduce maternal and child deaths and decrease infectious diseases, much more is needed to be done to reach our goals to reduce the burden of NCDs. Following the official presentations, member states were invited to make statements on each of the goals, presenting their own progress. And some highlights from the member state statements included the overarching need to achieve universal health coverage for all in order to achieve SDG 3, and really driving home the point that multi-sectoral action beyond the health sector is required, with a particular focus on the environmental determinants of health. There was quite a lot of discussion on the detrimental effects of air pollution on human health and well-being. Another point was reliable information systems and robust data, the need for civil registration and vital statistics systems. And again, the whole of government and society approach, so engagement of civil society, communities, and people at all levels, and every step of the process of implementing, evaluating, and monitoring progress towards the SDGs. Again, there was recognition that NCDs are on the rise worldwide, and governments and health systems are wholly unprepared for the toll that they take, and they will take. So there's a summary of the HLPF available there at the link. And the link will be live when we post the slides online. Additionally, there were voluntary national reviews presented by over 40 countries, and this is when countries are able to present their progress and challenges towards achieving the SDGs. There were a few countries, including Chile, who spoke about NCDs and some of the policies they are implementing, including nutrition labeling and some taxation policies to improve NCDs. Next slide, please. So additionally, there are quite a few NCD-related side events, and the next couple of slides are just a review of a few of them. The first is an event that NCD Alliance co-hosted with the governments of Chile, Thailand, and the World WHO. And this was looking at how nutrition and diet-related NCDs affect the achievement of other SDGs beyond health, and so looking beyond SDGs 2 on nutrition and SDG 3 on health. There was a strong focus on countries' case studies of successful nutrition policies, with examples from Chile, Thailand, and Mexico, as well as a focus on needing to achieve the UN Decade of Action on Nutrition, and how doing so will accelerate progress in some of the other goals in the SDGs as well. Again, one of the things that came out of this discussion was the requirement for political will and leadership at the highest level in order to implement policies and combat industry interference. Next slide, please. A couple of the other NCD-related events included an event hosted by the UN Interagency Task Force on NCDs, and this event discussed the work of the task force to date and the need for coordinated action across agencies and departments. And the event highlighted some of the recent country missions and the momentum that the task force has sort of generated towards NCD prevention and control policies in different countries. The Russian Federation restated their call for a conference on financing for NCDs to discuss sustainable mechanisms for NCD prevention and control. So that's something that's really good to hear from an NCDA perspective, as we know that without financing for NCD policies and programs, we're really not going to achieve our goals. NCDA participated in this event and delivered a statement on the importance of civil society participation in the task force missions to help continue the momentum and really ensure the successful implementation of the recommendations from these mission reports. And there is a summary of that event available as well. And then there was the launch of the new Global Tobacco Control Report, co-hosted by WHO and Bloomberg, and it showed that while progress is being made on tobacco control policies, industry interference continues, as we know, to really hamper the efforts. And again, a summary of that launch is available. Next slide, please. So moving on to the UN General Assembly, this is happening in just a few weeks now. So the 72nd session will open on Tuesday, the 12th of September, and the general debate and the high-level segment, the high-level week, will open on the 19th of September. So the overall theme is focusing on people striving for peace and a decent life for all on a sustainable planet. And I think we can see here reflected the new Secretary General's priorities and focus, as we know he's coming from the human rights perspective and refugee focus. So I think that's something that's reflected in the theme here. Thus far, the Secretary General's office has released reports on education for sustainable development, environmental conventions, and social development. And so there are links, as you can see there, for each of the reports that have been released, and will really provide a framework for some of the discussions moving forward into UNGA. A draft program of work is now online, and more information will be coming in the next few weeks. Next slide, please. And finally, a very, very brief snapshot of some of the events taking place during the high-level week, NCD-related events. On the Monday, there's a launch of the Essential Medicines and Technologies for NCDs Coalition Monday afternoon, followed by our own NCD Alliance event in the evening. Tuesday afternoon, NCD Child will be hosting an event on the importance of youth participation in NCD Advocacy. Wednesday, Access Accelerated will be hosting an event in the evening on public-private partnerships. So more information to come. We'll be sharing a detailed calendar of events as well as RSVP information as available. And in the meantime, we encourage you to please share details of any events you are hosting or might be aware of so that we can add them to the calendar. And that is all for me. Thanks very much. Back to you, Katie.
Thanks very much, Priya. I don't think we've got any questions coming in around UN updates. And just one question from me. So now that we have experienced a high-level political forum, because obviously this is only the second since the SDGs were adopted, and this is the first time that health was reviewed, how important an event do you think it is for NCD advocates compared to obviously the UN General Assembly?
I think it is quite important for NCD advocates, again, because we're trying to really show how NCDs are integrated throughout the agenda. Again, many of the determinants and risk factors for NCDs are actually outside of Goal 3 on health, and the way that the HLPF has been divided into the subset and thematic reviews means that these determinants are reviewed in the coming years. So I think it'd be quite important for the community to be out in some manner to really show that NCDs are part of this development conversation and very much part of the SDGs.
And when will health be reviewed next?
And that will be decided at the end of the current cycle, so after 2019. The HLPF will look at how to divide the goals again. Okay, great. Good. And presumably this UN General Assembly is obviously important for us because this will really mark the kind of one-year countdown to our UN high-level meeting on NCDs for 2018, right? Yes, definitely. I think the new President of the General Assembly will take office in September, and he will be the one who is really spearheading the discussions on modalities and sort of the process for the 2018 high-level meeting. So I think it will be important for us to be there in that respect. Great. Thanks very much, Priya, for that really useful presentation, which I think, next slide please, brings us to the end of our webinar. Just a quick recap of some of the actions that were presented by different speakers today. So Bente obviously shared with us the deadline for the Uruguay Montevideo roadmap, which is this Friday the 25th of August, for comments on the Montevideo roadmap. And she also encouraged us to reach out to our own governments to support high-level participation in the Uruguay conference this October. We also heard from Fiona in terms of the physical activity
plan being developed by WHO. Deadline for that one is the 22nd of September. Similarly, an online process that can be found on the WHO website. And we also really encourage everybody to share any planned events around the UN General Assembly this September, and look out for our events calendar that will be coming out in the next couple of weeks. Finally, just a reminder, we'll be publishing all of these slides on our website, as well as the recording of the webinar if anyone wants to go back and listen again to any segment of it. We'll be having our next webinar after the UN General Assembly later on in September. Thank you everyone for joining, and have a good rest of your week. Thank you. Goodbye.
That does conclude today's conference. Thank you for your participation.